Hi, I'm Paul Tunnah, and welcome to this new video series where I'm speaking with healthcare innovators. I'm very pleased to welcome today David Van Sickle, founder of Propeller Health, which very cool respiratory company in the digital health space, and probably one of the most successful, I would say, digital health companies. So great to have you here, David, and look forward to hearing more. Welcome.
Thanks, Paul. It's great to be here. Thanks for having me on today.
So let's start with your journey before Propeller Health. What were you doing before you started this company?
Yeah, I started Propeller with Greg Tracy back in 2010. Before that, I'd had an academic career focused on chronic respiratory disease. So I was in graduate school for medical anthropology and was actually doing research on asthma in different communities around the world, including places like the Navajo Reservation and up in Alaska with the Yupik Eskimos, an Alaska Native population there. Essentially trying to make sense of how households and physicians and families were trying to manage day to day, the burden of asthma and COPD in those communities, and learning about the ways in which the disease and its approach to treatment, varied across different locations. It was an insight that and an experience that that ended up leading to the creation of Propeller, because we thought that technology would essentially give people tools to help accomplish the work of illness, and that by connecting their medications and understanding how people were doing in their the day-to-day course of living with asthma or COPD, we might be able to help support and steer them towards more effective self-management and better care and treatment. I ended up doing my dissertation research over in India, and essentially trying to understand what was happening with asthma and allergy in that setting, and then came back to the U.S. and started working for the U.S. Centers for Disease Control and Prevention in Atlanta. So I spent a few years there as part of the Epidemic Intelligence Service, focused on asthma and on and respiratory and air pollution, and essentially trying to help identify and put a stop to outbreaks of diseases like that that became of public health importance. So
Sure.
It really grew out of that Propeller, that experience and that history, and then since 2010 I've been focused on the business full time ever since.
And in terms of your inspiration for the business, was there a kind of light bulb moment where you thought, I'm going to do this, or was it a gradual sort of evolution of your thought process?
Probably both. In some ways, what I realized at CDC was that we never had timely or geographically specific data enough to help us be as effective as we could be with applied public health interventions. So at the same time, I was looking back over the literature to try to understand where we'd seen sort of epidemic asthma emerge, because generally when a disease kind of breaks its ordinary bounds, it's an opportunity essentially to understand how it's working, and
Sure.
In some ways kind of teach you ways in which you might be able to intervene more effectively. Well, there weren't many cases where we'd actually seen epidemic asthma in the literature, but I was attracted to one in one event in Spain that was well described in the literature back in the early 80s. And it ended up being an outbreak of asthma, a series of outbreaks that were all associated with exposures to soybean dust released from the harbor silos in Barcelona. It was this one time where essentially the insight was that with people having medications for asthma and using them in daily life at the time and place where they had exposures, we realized that if you were able to monitor that or to understand where those symptoms were occurring, you might be able to essentially build a real-time map of where, when, among whom asthma is happening in a community, and then use that to guide and evaluate, your public health interventions. It was also an insight that the border between public health and individual clinical sort of medicine was an artificial one, and that what was happening at an individual level could be aggregated in a way that would teach you something about a community or a population's health. And one thing that we've tried to kind of continue at Propeller is to, treat that as an artificial border forever, and to continually traverse it in ways in which we can use what's happening in a community to better understand what's happening or support what's happening in individuals, right, and vice versa, right? And I think we're still just beginning to approach that, honestly, and digital is what makes that possible, but we're really at the very early days of that.
Yeah.
For example, when a bunch of people in a community are using Propeller, we're able to see kind of an envelope of risk passing over that community, see individuals worsening or see a group of people worsening. And we probably at some point will be able to make recommendations about how the treatment should be adjusted, or things people could do to avoid or mitigate exposures that would worsen symptoms. But again, that's very early days, but it was one of the kind of motivational principles behind the company way back when.
And I mean, you and I met before about 18 months ago. I remember the soybean story. It kind of sticks in my mind. It's a great backstory with the company.
Yeah.
And you've seen this thing grow and evolve, Propeller Health, over the years. And you touched on a little bit there, kind of what you're now doing and what the potential could be. But the digital health space, as you know, has become very, very busy. So how do you describe the USPs of Propeller Health versus other things in this space?
Yeah, I think digital health has become busy, but honestly, I think there's still it's still very early days, right? I mean, in the case of asthma, we've known for a while how well we should be able to treat it and how well people should be doing in daily life. But the reality is that the majority of people with asthma still don't have their symptoms under control and still aren't able to participate fully in the activities they choose. So literally, despite decades of innovation and better understanding of the disease and new medicines and highly effective medicines, it's still it's very early on. We need to just get a much better start at applying what we already know.
Yeah.
And I think digital is starting to get us there. But while busy, I think there's still some very basic first steps that still have to happen in terms of adoption and application of the benefits of digital and its partnerships with medicines and treatment and so on. So
yeah, still I guess finding its space within the ecosystem to some degree, isn't it?
Yeah, exactly. And helping people understand what's possible, right? I think in the case of chronic respiratory disease, people for a long time learned or have been taught or learned to accommodate symptoms, right? So they don't realize that a lot more could be done to prevent symptoms from occurring. And so they go on waking up at night or, having to withdraw from activities or what have you, when in reality, we should have much better expectations about a almost symptom-free life. And it isn't for a lack of interest on their part, right? We have, if you look at the health econ data for asthma, there's a very high willingness to pay if you ask patients and their families about how much it's worth it to them to have a day free of symptoms. They put a pretty high price on that. Yet adherence with the medications that are well known to essentially help prevent those symptoms from occurring is really low. And I think there's been a history of assuming that meant that people weren't interested in managing or kind of avoiding those symptoms, when in fact I think it just teaches us how early and how poorly designed our tools are. We have long ways to go and a lot to do, and if you have daily regimens and no one's taking them, at some point it isn't a problem of adherence, it's a problem about innovating in the regimen and making it more understandable or more easy to use, more simple, convenient, personal, accessible and stuff. And that's what I think digital brings so nicely to respiratory medicines and the care and treatment of asthma and COPD.
So in that context of change and things moving so quickly, does the business now resemble in any way your vision when you started it?
Oh yeah, it does. I mean, we're still a hardware-enabled software company, right? So we build sensors that connect to people's daily inhaled medicines and their as-needed inhaled medicines, the drugs they take to make themselves feel better when they're having symptoms, and then the ones they take that are designed to address the underlying inflammation and such. But in reality, we think about ourselves as an experience company. We're trying to take that data, which didn't exist, so we had to create the sensors to bring it into life, right? But what we use that information for is to try to reshape that experience of asthma and COPD in a way that makes it, easier for people to essentially accomplish the work of those conditions with less effort or, less hassle. And so doing that in a way that's minimally invasive, so to speak, or minimally burdensome has, been kind of one of the motivating principles all along. I don't think anything has really changed with the company other than a couple of years in, we decided to focus beyond just asthma, which is where we started. So we added COPD and, we've been working kind of across both those conditions ever since. The background, a kind of familiarity with tools and the idea that you would use apps and sensors and data to help support self-management has certainly changed. People have started using Fitbits and wearables and all of that, and so there's been kind of relentless and increasing consumer expectations for the role of digital in their health, as there should be, just like we've had similar trends in other areas of our life. So you're always kind of working against that, trying to make your stuff better and more meaningful. And then at the same time, at least in the US, we've had very uneven kind of healthcare backdrop, right? For a while, Propeller wasn't sure whether there was going to be, whether Obamacare would be repealed or what and what happened to it. And so you kind of had to build a business for a fee-for-service environment and for a value-based care one, and in some ways you still have to. So it in a sense it does resemble what we've what we set out to do. We still focus on both the individual and the community to the extent we can, and in other ways we've had to adapt to just a very dynamic 10-year period. So.
And obviously as we record this, we're just ahead of the American election, so who knows where things will go. We're not going to get into politics, but it could go in any direction.
Yeah, exactly. And from Propeller now heading into this year and next year, we've been focused on bringing what we do to new markets, to the EU and to Japan, mostly in partnership with Novartis. But those are very different kind of contexts in which healthcare is delivered and in which people think about their health and data. And so there's still like a lot of work ahead there.
And of course you were fairly recently acquired by Resmed. How's that impacted the business and how's that changed things for you?
Well, they work in literally 150 some odd countries around the world already. And they're well known both as obviously of a provider of devices for sleep disordered breathing, but also as a real innovator in digital health. So they were for a long time connecting their machines to the network to better understand and to support more optimal adherence and patient management of their condition. So for us, it's given us a chance to work with teams in the US and elsewhere that have vast infrastructure, accumulated wisdom, experience commercially from a regulatory standpoint, and so on, to essentially bring Propeller into those markets and those populations, which would have taken us a lot longer to do on our own. So Resmed wasn't an investor in one of the ultimate fundraising rounds that we raised as a private company or as a startup. They participated in that, and then over the course of events there, got to know Propeller, and we started working more and more closely together. And then we were ultimately acquired by them at the very beginning of 2019. So it's been about coming up on 2 years, and I feel really fortunate to have landed where we ended up. So it feels like like an older brother of Propeller, obviously
Right.
with a
Yeah.
much bigger balance sheet.
Yeah,
So,
well, particularly in a somewhat turbulent 2020, as we all know. But I mean, if you go back to the point of that acquisition, I mean, this is your baby. You've kind of grown this thing up. At the time, was it a hard decision or was it fairly straightforward?
no, fairly straightforward, actually. Like I said, we'd had a great relationship with the company, or at least parts of it, who'd been around Propeller since their investment and for a little while before that. But it felt like a very similar culture, a very
Right.
similar focus on respiratory health. Lots of interest in what they had built on the digital side and where they were headed from the digital and data perspectives. It felt like a great fit and a chance to essentially help accomplish a higher and bigger mission than Propeller on its own.
Yeah.
Obviously, the natural history of Propeller was to raise equity financing to grow the company over time, but the relationship with Resmed ended up kind of superseding that, and I think the record of the past 2 years has been really exciting, and the chapter that we're writing today about bringing Propeller with Resmed to the EU and to Japan is one that I'm really proud to see the team execute, and it feels like a chance we might not have had for a while had we stayed independent. So
Yeah, it's a great story. And as you look back, and maybe even before the acquisition, is there something that stands out in your mind as the biggest challenge or even your biggest mistake as you were growing this company?
so many. Yeah, I think. Yeah, I think we assumed that the adoption and that would happen a lot faster, and that it would be
Right.
put to work in a much more direct way. And I think that that's still something we wrestle with. How do you bring to healthcare providers and to patients a digital experience where they've never had one before? That it's not like you're competing for share or against an incumbent. Essentially, you're trying to explain to them that and demonstrate that a new way and theoretically a new way that uses less of their time and attention, right, is possible through what digital can add. So I think that's just a never-ending struggle. And
Yeah.
If you roll back to the early days, we thought that that it would just be a straightforward line from founding the company and to getting it FDA cleared to to having it in some majority of patients' hands, and it's not been that at all.
Yeah. I think anybody who starts a company sees that kind of straight line, and very rarely does it go in that direction.
Right. Yeah. And you also think it's going to be about the idea, right? That if you just figure out kind of one more marginal improvement on the idea, that, there's some direct relationship to success. But in the end, it actually ends up being just all about hiring and who you attract to the mission and how you support them and how the group works as a team and stuff. So, yeah, that's what you have to get good at, honestly.
Yeah. No, and I completely agree with that. I know you and I have touched on this before. So if you look at this year, 2020, we've had this little thing called COVID-19 flying around the world. And a lot of people talking about how it's really accelerated use of digital in healthcare. It's transformational. Is that something you've seen? Do you see a big impact there?
Yeah, in some ways we have. So as you know, it's definitely provoked a big increase in enthusiasm and energy for remote monitoring approaches. And frankly, they make a lot of sense, right? It wasn't like the old in-person visits were working out so well for patients with asthma and COPD. So anything we can do to help, improve the outcomes on an individual basis are important. But on the other hand, I think it's obviously taken a ton of time and attention on the health system side to deal with, and you've seen voluntary procedures drop off, and so there's budgetary scrambles, at least in markets like the U.S. So it's been mixed, I would say. It's like a bimodal thing. Lots of interest on one hand, and there's been supportive changes to regulation and reimbursement that are definitely helping. to realize the potential. On the other hand, handling COVID and all the sequela in terms of daily visits and voluntary procedures and stuff and budgets that go along with that has been has presented its own set of challenges.
Yeah.
So I do think it will bring about a change in the way in which people manage chronic diseases, as it should, because I think, by any measure, we haven't been accomplishing nearly what we should have been able to achieve in terms of, knocking down asthma and COPD as sort of daily hassles. And so there's really lots of room for improvement, and hopefully this puts us on that path.
Yeah, still very much that focus, isn't there, on kind of treating the disease rather than treating the person, and whole person care, as it's often called.
Yeah, I think that's a good way to think about it. And, I do think that that some of the health systems now are starting to approach it in a more holistic and proactive way. So to the extent we can consolidate some of this work around, a patient experience, I think should be wholly beneficial.
And the digital health space is obviously exploding. You keep seeing all the numbers of investment going in, and it's not necessarily an easy journey building a digital health company. I think Propeller Health and yourself, you've been very successful, but there's a lot of hard work involved in that. So to people who are starting out with a digital health idea or just starting out with their company, what's the key bit of advice you would give to them?
Well, it is. I mean, I think the history of Propeller is there's a couple of things that come to mind. The importance of hiring is fundamental. You got to plan to stay alive for a while, because things can happen and do all the time. I think the last 12 months have been an example of how you can have kind of major upheaval and uneven context and environment around the company. I feel fortunate to have spent the last 10 years in digital health, because it's an area that Tim O'Reilly calls out for being able to create more value than you capture. And so I think the companies that have demonstrated or are investing in demonstrating an ability to lower costs and improve outcomes, there'll always be a market for that, and patient and physician demand. So there'll be things to figure out, obviously, details and complexities around it. But if you can demonstrate that and bring, and bring that evidence forward, like the opportunity to build a business that has, real value and meaning to people all over the place is huge.
Yeah.
So hard to do, but worth trying.
Worth the journey.
Yeah.
So let me finish with a couple of more personal things about you.
Sure.
So first of all, is there sort of one person who's been your inspiration through this journey?
Maybe not entirely aware of it, but way back when I started Propeller, there was a guy named Todd Park who went on to become the CTO of HHS and a bunch of other roles. He and Anish Chopra and a few others were really instrumental in building kind of enthusiasm in a community, an ecosystem around what could be done with health data, and just encouraging me and a bunch of others to build companies. I was an academic at the time, essentially to leave that role and to try to commit myself and my career to what could be accomplished at that frontier. And I think without the energy that they marshaled and just their kind of relentless support and enthusiasm, we wouldn't have made it where we are. So that's always been in the back of my mind. And I've probably never been able to express that to them, but I'm really grateful that whatever energy they added to me kind of kicked me out of an orbit of otherwise becoming a boring academic.
Yeah. Well, hopefully they're watching this video and you're conveying it.
Yeah, that would be great. Someday.
It's interesting because there's usually a kind of mentor or some kind of inspiration behind, people at the start of that journey. So last question, and again, this is very broad, but I'm just intrigued. If there's somebody you've never met, somebody you'd love to meet, but you've never met so far from any walk of life, who would that be?
Let's see. Well, honestly, having now spent 9 months kind of in daily contact with I've got 3 boys. I'm very curious what they're going to be like as later in life. So I would love to be able to meet my kids, I don't know, 30 years in the future and see how they turned out. I mean, hopefully I'm still around then, but not a guarantee. So I've spent a ton of time with them over the quarantine and the COVID period, and I'm really eager to see what they turn out to be. And in terms of work, there's quite a few people actually. There's a guy named Soren Matke who wrote a paper. It was at Rand. He wrote a paper called "Medicines as a Service" a bunch of years ago. That has always been kind of like a framework for how I think about digital health, and just his ability to kind of synthesize and see ahead and to see what was possible. And with the addition of digital, is something that's made a huge impact on me. But it's not a fellow I've ever crossed paths with, unfortunately. There's loads like that. I think digital health is home to some of the most remarkable and unfairly young and smart people in the economy today. So, I was fortunate to meet Sean Duffy early on when Omada and Propeller were both funded by the same angel investor way back when, and followed his career. And it's just a super impressive, person and leader. So he's someone I know well, but the industry as a whole, I think, just brings those people out and and in a great way, kind of motivates old timers like me.
Well, I'll see if I can make some of these connections happen. I'm not sure I can help you connect with your kids in the future, but I love that. That's a great.
That would be awesome. Hopefully they turn out all right.
Yeah, well, exactly. And as a parent myself, definitely the most important project you ever have in your life is your kids. So
yeah,
totally appreciate that. Look, David, it's been great catching up again, and obviously great to see the continued success of Propeller Health. Long may it continue. But thanks for
Paul.
taking the time to chat with me. Really appreciate it.
Yeah, of course. Happy to do it. Thanks for having me.